The moment Emily Carter walked into Riverside Memorial's trauma bay that morning, Linda Brooks looked at her arms and took a step back, not out of sympathy, but contempt. The scars ran from Emily's wrist to her elbows, pale and ropey, impossible to miss in short sleeves. Someone in the back of the nursing station muttered something. Someone else laughed. Emily didn't look up. She'd heard worse, she'd survived worse, but none of them knew that yet. None of them knew what those scars meant or what the woman wearing them had already walked through before she ever set foot in this hospital. That was about to change. If this story already has you hooked, do me a favor. Hit subscribe and follow along until the very end. Drop a like and leave a comment telling me what city or country you're watching from. I love seeing how far these stories travel. Now let's get into it. Cedar Falls, Iowa was not the kind of place where dramatic things happened. It was the kind of place where the high school football team made the regional finals every 3 years, and people still talked about the ice storm of 2019 like it was a shared trauma. Riverside Memorial Medical Center sat at the edge of town like it always had. 6 floors of beige brick, a parking lot that flooded every spring, and a staff that had worked together so long they'd stopped being polite and started being honest with each other in the worst possible ways. Emily Carter had been there 4 months. She wasn't from Cedar Falls. She wasn't from anywhere nearby. She'd transferred from a smaller clinic in the eastern part of the state. Quiet about her past, quiet about most things. She showed up on time, did her work without complaint, and kept her sleeves rolled down whenever she could. On the mornings, the air conditioning was broken, which was often because the hospital board had been delaying the HVAC replacement for 2 budget cycles. She couldn't. And on those mornings, Linda Brooks always noticed. Carter. Linda's voice came across the nursing station like a door slamming. Supply run. We're short on 4x4 gauze in Bay 3, and someone apparently forgot to restock the saline flush cart. Again. Emily looked up from the chart she was entering. I restocked that cart at the end of my shift yesterday. Then do it again. There were 4 other nurses within earshot. None of them said anything. 2 of them looked at their screens with the focused concentration of people pretending very hard not to be there. Linda was the senior charge nurse on the day shift, 11 years at Riverside, known to administration as efficient, known to the staff as something considerably harder to say out loud in a professional setting. She had opinions about everything, about which nurses were trauma capable, about who should be assigned to critical cases, about who looked like they belonged in an emergency room and who looked like they'd wandered in from somewhere they didn't quite fit. Emily set down her stylus and went to the supply room. She wasn't angry, exactly. Or she was, but she'd learned how to put that anger somewhere it wouldn't cost her. She'd learned that in a different context, a harder one, and the skill had carried over. She pulled the gauze packages, counted out the saline flushes, and loaded the cart methodically. Her hands were steady. They were always steady. Down the hall, Bay 4 had a 63-year-old man coming out of a hypertensive crisis. Bay 7 had a kid with a dislocated shoulder who kept trying to bargain his way out of the reduction procedure. The trauma bay at the end of the corridor, Bay 1, the big one, the one with the extra equipment and the direct line from the ambulance bay, was empty and waiting, the way it always was, ready for something nobody wanted to need it for. Emily was pushing the cart back toward the station when Linda stopped her. Not that way. Linda was standing at the entrance to the main corridor, arms crossed, reading glasses pushed up on her forehead. Patient in Bay 2 needs a 12 lead. Take the cart back first, then go to Bay 2. I can do both at the same time if I didn't ask what you could do at the same time. I gave you an instruction. Emily looked at her. Linda looked back. Okay, Emily said. She took the cart back. Then she went to Bay 2. The patient there, a retired teacher named Harold, 68, reading a crossword puzzle on his phone while hooked up to a cardiac monitor, watched her attach the leads with the kind of calm competence that only came from doing something thousands of times. He was a perceptive man. You've done this before, he said. Once or twice, Emily said. Somewhere other than here? She smoothed the last electrode into place. Why do you ask? He shrugged with the shoulder that didn't have a lead on it. You move differently than the other nurses, like you already know what's going to go wrong before it goes wrong. Emily didn't respond to that. She checked the lead placement, made sure the monitor was reading clean, and told him the cardiologist would be in within the hour. She was almost out of the bay when Harold said, without looking up from his phone, "Whatever they're doing to you out there, don't let them make you small." She paused in the doorway. "Thank you, Harold," she said, and meant it more than she could say. The morning moved the way mornings in an ER always did, in bursts of urgency separated by long stretches of documentation and restocking and the particular institutional boredom of a unit that existed in a permanent state of potential emergency. Emily moved through it without standing out. That was intentional. She'd learned early at Riverside that standing out attracted Linda's attention, and Linda's attention was the kind you didn't want. It was during a lull around 10:15 that it happened. A pediatric patient in Bay 5, 8 years old, in for a respiratory issue, started desaturating faster than anyone expected. The boy's oxygen had been sitting at 93, which wasn't ideal, but wasn't immediately critical. Then the monitor alarm went off and the number dropped to 87 in under a minute. Emily was the first person through the bay curtain. She assessed fast. His breathing was labored, accessory muscles working hard, the kind of compensatory effort that meant he was getting tired. She grabbed the pediatric mask from the wall hook and turned up the flow rate, supporting his airway positioning with her other hand, talking to him in a low, steady voice, even as she called for the on-call pediatrician over her shoulder. Linda appeared in the bay entrance within 30 seconds. She took in the scene, Emily at the head of the bed, the child's oxygen already ticking back up on the monitor, and her expression shifted into something that looked almost like disappointment. "I've got this covered," Emily said, not looking away from the child. "Step back," Linda said. "You're not assigned to PEDS today." "He's recovering. Give me 30 seconds. "Carter." Linda's voice dropped to something quieter and more dangerous. "Step back from that patient right now, or I will write you up for insubordination before lunch." The pediatric resident arrived at a jog. Dr. Nadia Osei, second year, competent and perpetually underslept, and took in the situation with the quick situational read that good residents develop fast. The boy's oxygen was at 92 and climbing. His breathing had slowed to something less frantic. "What happened?" Nadia asked. "Acute desaturation responded to repositioning and supplemental O2, Emily said, stepping back. "He was compensating with accessory muscles. He's stabilizing." Nadia moved in, did her own assessment, and nodded. "Good catch." Linda said nothing, but Emily felt her watching as she exited the bay, and she knew, with the bone-deep certainty of someone who had learned to read threat environments, that the write-up was coming regardless. It came after lunch. Linda dropped the printed form on the nursing station counter in front of Emily without a word. Documented as unauthorized clinical intervention, failed to defer to assigned staff. Emily read it twice. She picked up a pen, signed it where indicated, and placed it in the documentation tray. "That's it?" Linda said. "No argument?" "Would arguing change anything?" Linda studied her for a moment with an expression Emily couldn't entirely read. "You know what your problem is, Carter. You think that because you can do something, you're entitled to do it. That's not how this unit operates." The child's oxygen was at 87, and there were 3 people with the appropriate assignment who would have handled it. "In how long?" Linda's jaw tightened. "Watch your tone." Emily looked at her. "Understood," she said, and went back to her documentation. 2 hours later, she was in the staff break room eating a sandwich and trying not to think too hard about anything when Nadia Osei sat down across from her with a cup of terrible machine coffee and the expression of someone who wanted to say something and was working up to it. "Linda filed a report on you," Nadia said. "I know. For saving a kid from hypoxia. For unauthorized clinical intervention." Nadia wrapped both hands around her coffee cup. "I put a counter note in the chart. Documented the intervention and the outcome. She can't erase that." Emily looked at her. "You don't have to do that." "I know." Nadia shrugged. "I did it anyway." She paused. "Where did you train?" "Iowa City initially, then a few different placements." It wasn't a lie. It was just not the whole truth, which was something Emily had become very good at maintaining. Nadia didn't push it. She drank her coffee, grimaced at the taste, and said, "For what it's worth, you moved like someone who's seen a lot worse than a desatting 8-year-old." Emily took a bite of her sandwich. "Kids are always the hardest," she said, "whatever else you've seen." Nadia nodded slowly and didn't ask anything more. The afternoon shift change brought new patients and new problems in the way that afternoons at Riverside always did. A gradual thickening of the ER's population, the mix shifting from morning's walk-ins and scheduled procedures toward the harder, more complicated cases that daytime tended to delay until things got bad enough to stop ignoring. Emily was midway through a dressing change on a patient in Bay 6 when she heard it. Not the sound itself at first, just the change in the building's ambient noise. The particular quality of attention that moved through a staff floor when something was happening outside the normal scope. She heard someone in the corridor say something she couldn't make out, and then she heard Linda's voice from the direction of the nursing station, sharp and directive in a way that was different from her usual sharpness. Emily finished the dressing, secured the tape, told the patient she'd check back in an hour, and stepped into the corridor. Through the glass doors at the far end of the hall, the ambulance bay entrance, she could see vehicles. Not the usual ambulance, not the fire department transport she sometimes saw on busy afternoons. These were different. A dark green truck, military grade, followed by a second vehicle of the same type, both moving at speed into the hospital's receiving area with the particular urgency of people who did not care about parking regulations. She stood still for a moment. Then she heard the radio at the nursing station crackle and the triage coordinator's voice. Trauma activation. Bay 1. Military personnel incoming. Critical. Emily moved without deciding to move. She was already in the corridor, already heading toward Bay 1, and she was halfway there before she registered that she was doing it. Behind her, she heard Linda's voice. All non-assigned staff, clear the trauma corridor. I said, clear the corridor? Emily kept moving. The ambulance bay doors burst open and the gurney came through at a run. 3 men in military utility gear moving it, and a fourth man walking alongside with his hand pressed to his own neck like he was holding something in. The man on the gurney was in his mid-30s, broad-shouldered, wearing a torn base layer shirt that had been cut open at some point to expose his torso. His chest and upper abdomen were bandaged with field dressings that were soaked through. His skin had the particular grayish cast that Emily recognized from a context she rarely allowed herself to think about directly. The men pushing the gurney were calm in the specific way that people who spent a great deal of time in high-stakes environments learn to be calm. Not the absence of urgency, but the control of it, urgency channeled into function. One of them was speaking into a radio. Another was watching the patient's face with the focused attention of someone tracking something very specific. Dr. Ren Takahashi, the ER attending on duty, 50s, 30 years of emergency medicine, the kind of doctor who had seen enough not to startle easily, met the gurney at the Bay 1 entrance and started his rapid assessment. The trauma team assembled around him, 2 nurses, the respiratory tech, a second-year resident named Marcus who was still pulling on his gloves. Emily stood at the threshold. The patient's pressure was in the dirt. She could see it in the monitor readout that the military medic was reciting to Dr. Takahashi, could hear the number and know immediately what it meant. The field dressings were doing their job, slowing the loss without stopping it, but they'd been in place long enough that the tissue underneath was a problem now, not just the blood. There was something about the pattern of the injury that her mind was processing faster than she could consciously articulate, a shape to the damage that she recognized from a different time and a different version of her life. He needs a surgical consult right now, Dr. Takahashi said. Where's Vance? In an OR, 40 minutes out, someone called back. Get me Hendricks. Hendricks is at County. Then get me whoever's available. Emily took a step into the bay. Nobody stopped her. They were too busy. She moved to the left side of the gurney, where the primary dressing was positioned, and looked at the wound beneath it with the clinical detachment she'd cultivated over years of practice in environments where detachment was the only thing that kept your hands from shaking. The secondary bleed is lateral, she said. Not loudly, just clearly. Dr. Takahashi glanced at her. Carter. The dressing is addressing the primary entry site, but there's a lateral bleeder that's still active. You can see it in the drainage pattern. She pointed without touching. If you pack the primary site better and compress here, she indicated the position, you can reduce the loss rate while you wait for surgical. The room had gone briefly, oddly quiet. One of the military men, the tallest one, standing at the head of the gurney with his arms crossed and his eyes moving constantly over the situation, was looking at her. Dr. Takahashi made a decision in the way that 30 years of emergency medicine teaches you to make decisions, fast, on incomplete information, betting on the most credible-sounding option. Marcus, he said. Do what she said. Marcus looked at Emily. Emily showed him the position. His hands moved and the monitor's pressure reading, which had been dropping in the slow, steady way that was more frightening than a sudden crash, stabilized. Not high, but stable. Good, Dr. Takahashi said. And then, to Emily, stay. Linda appeared in the bay doorway. Emily didn't turn around. She didn't need to. Dr. Takahashi, Linda said, Carter is not on the trauma team assignment for today. She needs to. She's here. She stays. Takahashi's voice was flat. Not unkind, but entirely final. Linda, I need the OR coordinator on the phone. Now. There was a pause that felt longer than it was, and then Linda was gone from the doorway, and Emily was still standing at the left side of the gurney, and the patient on it. This man whose name she didn't know, whose background she could only partially guess at from the bearing of the men who had brought him in, opened his eyes. They were dark eyes, and they found her face with a directness that was startling. He was in pain, considerable pain, held at a manageable distance by whatever the medic had administered en route, and he was fighting to stay present, the kind of active, deliberate effort to stay conscious that Emily recognized as trained behavior. He looked at her arms, where her sleeves had ridden up during the procedure, and then back at her face. He didn't say anything. He didn't have the breath for it right now. But his expression changed in a way she noticed, a slight adjustment, the kind of recalibration that happened when someone looked at a person and revised their first impression in a significant direction. Emily looked back at him steadily. Stay with me, she said. Surgery's coming. His jaw set. He nodded. Barely, just a millimeter, and his eyes stayed open. Outside Bay 1, in the corridor that Emily could hear but not see, she was aware of Linda Brooks talking to someone in the low, controlled voice that meant she was managing a situation she was angry about. She was aware of the other nurses moving around the periphery of the trauma bay, the glances being exchanged, the particular silence of a staff that had just watched something unexpected and hadn't yet decided what to do with it. She was aware of all of it, and she stayed exactly where she was, because the man on the gurney needed someone to stay, and she was the person in the room who knew how to do that without flinching. His pressure held for the next 22 minutes until the surgical team arrived. It was a long 22 minutes. Emily spent all of them at the left side of the gurney, watching the monitor, adjusting the compression when it needed adjusting, and talking to him. Not meaningless reassurance, but actual information, what the numbers meant, what was happening, what came next. She didn't know if he could process all of it. She told him anyway, because in her experience, people in crisis deserve to be told the truth about what was happening to them. When Dr. Hendricks finally walked through the bay doors, slightly breathless, still in scrubs from the county call, and took over, Emily stepped back without being asked. She stripped off her gloves, dropped them in the waste bin, and was almost out the bay door when the tall military man who had been watching the whole time stepped into her path. He was maybe 45. His face was the kind of face that had been outdoors in difficult weather for a long time. His posture was unmistakable, not parade ground stiff, but the particular easy erect bearing of someone who had spent years in a specific kind of work, and whose body had kept the shape of it. That was good work, he said. Not a compliment, a statement of fact, delivered in the flat, precise tone of someone who didn't use the word good loosely. Emily looked at him. Is he going to be okay? The man's expression shifted slightly. Most people, when they did something impressive, wanted to receive the credit for it before moving on to the next question. The fact that she hadn't, the fact that her first response was a question about the patient's outcome, registered visibly on his face. If surgery goes well, he said, he's tough. They all say that, Emily said. The corner of his mouth moved. Almost nothing. Yeah, he said. They do. She went around him, out into the corridor, and nearly walked directly into Linda Brooks, who was standing 3 feet from the bay entrance with the expression of someone who had been waiting specifically for her. My office, Linda said, when your shift ends. Emily looked at her. Linda's face was composed, professional, entirely controlled, but underneath it, in the set of her shoulders and the particular quality of her stillness, Emily could read something that she recognized from training she wasn't supposed to talk about. A person who had been publicly outmaneuvered and was processing the fact that they had been outmaneuvered and was constructing a response. Okay, Emily said. She walked back to the nursing station, picked up the next chart in her queue, and kept working. The surgery took 3 hours. Emily learned this not because she was in the OR or because anyone told her directly, but because she tracked it the way she tracked most things, through the ambient information available to anyone paying attention, the OR board updating, the anesthesiology team moving through the hall, the change in the quality of the military men's posture when someone came down to give them a status update around the 2-hour mark. Her shift ended at 7. She finished her documentation, did her handoff, and was pulling her jacket from her locker when her phone, her personal phone, not the hospital pager, showed a missed call from a number she didn't recognize. Iowa area code, but not Cedar Falls. She looked at it for a moment. She didn't call back. She put the phone in her pocket and went down the hall to Linda's office, which was a small room off the administrative corridor with a window that looked into an interior courtyard and a desk covered in the organized clutter of a person who needed to project control at all times. Linda was already behind the desk. She had the write-up form from earlier and a second piece of paper that Emily didn't recognize. "Close the door," Linda said. Emily closed it. She didn't sit. Linda looked at that for a moment and then looked back at her papers. "I want you to understand something," Linda said. "What happened in Bay 1 today was not a success. It was an unauthorized intervention by a nurse who was explicitly assigned to standard care duties and chose to override her supervisor's instructions, twice in one day. The patient's pressure held. That's not the point." "I think it's exactly the point." Linda's eyes came up. "You're very confident for someone on a performance improvement plan." Emily felt something shift in her chest. Not fear, but the recognition of what was on that second piece of paper. "When was that filed?" "This afternoon. After the incident in Bay 5 this morning. The Bay 1 situation will be an addendum." Linda placed both hands flat on the desk. "I want to be direct with you, Carter. Your instincts might be fine. I don't know what you did before you came here, and frankly, I don't care. What I care about is a unit that functions correctly, with the right people in the right roles, and you keep putting yourself in roles you haven't been assigned to, because they're not being filled. That's not your assessment to make." Emily looked at her. There was a version of this conversation where she argued, laid out the evidence, pointed at the outcomes, made the case. She knew how that version went. She'd had it before, in different rooms with different people. The outcome was always determined by who had the institutional leverage, and in this room, at this moment, that was Linda. "Is there anything else?" Emily asked. Linda held her gaze for a moment, searching for something. Capitulation, maybe, or anger, the things that would give her something to work with. Emily gave her neither. "Go home," Linda said finally. "We'll continue this tomorrow." Emily nodded. She opened the door, walked down the administrative corridor, and pushed through the exit into the parking lot. The evening air was cool and smelled like cut grass and diesel from the loading dock behind the hospital. She stood for a moment, just breathing. Her phone buzzed. The same number. She answered this time. "Emily Carter?" The voice on the other end was a woman's, crisp, formal, with the specific cadence of someone accustomed to giving information once. "Yes. This is Lieutenant Commander Dara Winslow, Naval Medical Coordination. I'm calling because your name came up in connection with a patient we had transported to your facility today. I wanted to confirm some information." Emily was quiet for a moment. "What kind of information?" "Just background. It'll only take a few minutes." A pause. "We know more about you than you might think, Ms. Carter. We've known for a while. We just wanted to hear it from you." The parking lot was empty. The hospital lights cast long yellow rectangles across the asphalt. "Known what?" Emily said, even though she already understood. Somewhere in the part of her that never entirely stopped being what she used to be, exactly what Winslow was about to say. "Known what exactly?" Winslow said, and her tone shifted just slightly. Not warmer, but more careful, the way people get when they're handling something they don't want to drop. "That you spent 14 months embedded with a forward surgical unit in a classified training support capacity. That you hold certifications in tactical combat casualty care, advanced trauma life support, and surgical assistance that most civilian nurses don't know exist. And that 3 years ago, you walked away from all of it and took a staff nursing position in Iowa." Emily didn't say anything. "What I want to know," Winslow continued, "is why." The parking lot light above Emily flickered once. A car somewhere on the street behind the hospital turned a corner and its headlights swept briefly across the asphalt before disappearing. "I needed something quieter," Emily said. A pause. Did you find it? Emily looked at the hospital building. Its lit windows, its beige brick, the ambulance bay doors still propped open from the evening shift. Not especially, she said. Winslow made a sound that wasn't quite a laugh. The man you helped stabilize today is Senior Chief Petty Officer Marcus Webb. He's going to recover. The surgical team got ahead of the bleed. Another pause, longer this time. He asked about you before they put him under. Wanted to know your name. Emily absorbed that. Is there a reason you're telling me this? Because he's going to want to thank you properly when he's out of recovery. And because the man standing next to the gurney, the one you spoke to, is Commander Ellis Varga. He doesn't give compliments. He gave you one. Winslow's voice was level, precise. We pay attention to the people Ellis Varga notices. Emily rubbed the back of her neck with her free hand. The evening air had gotten colder while she was standing there. I appreciate the call, Lieutenant Commander, but I'm just a floor nurse. Ms. Carter. Winslow's tone didn't change. We both know that's not entirely true. Get some rest. Someone will be in touch. The call ended. Emily stood in the parking lot for another full minute before she got in her car. She drove home the long way, not because she needed to, but because she needed the extra 20 minutes to let the day settle into something she could carry without it pressing too hard on the wrong places. She lived in a rental house on the east side of Cedar Falls, a small two-bedroom that she'd filled with almost no furniture and a great many books. She made toast because she hadn't finished her sandwich at lunch and hadn't eaten since. She sat at her kitchen table in the quiet and tried not to think too hard about what Winslow's call actually meant for the careful, unexciting life she'd been constructing in Cedar Falls for the past 4 months. She already knew it wasn't good. She came in early the next morning, not because she was eager, but because being early was armor. It meant she was already at the station, already in the rhythm of the shift, already functional and present before Linda arrived and began the daily work of making her feel like a liability. What she didn't expect was to find Dr. Takahashi waiting for her. He was standing at the nursing station with 2 cups of machine coffee, one of which he held out when she came through the door. She took it on reflex. He was not a man who made small gestures. He was the kind of doctor who communicated primarily through efficiency and occasionally through a very specific raised eyebrow, so the coffee meant something. Webb's out of recovery, he said. ICU, room 4. He's stable. Good. He asked for you this morning. Emily looked at her coffee cup. I heard he might. Takahashi studied her for a moment with the diagnostic attention of someone who spent his days reading people's faces for information they weren't actively volunteering. Carter, the intervention you made yesterday, I want you to know that I documented it accurately. What you identified, what you suggested, what the outcome was. It's in the record. Linda filed a PIP on me. I know. He said it without inflection, which was somehow worse than if he'd said it with sympathy. I've put a note in as well, my assessment of your clinical competency. Emily looked up from the coffee. Takahashi was not a man who did things without reason. Why? She asked. He was quiet for a moment, with the quality of someone choosing their words precisely. Because I've been in this department for 17 years, and I know the difference between someone who doesn't belong here and someone who's being made to feel like they don't. He picked up his own coffee. Go check on your other patients. If Webb's team reaches out about a visit, I'll clear it. He walked away. Emily stood at the nursing station for a moment, holding the coffee, and felt something complicated move through her. Gratitude that had no clean place to land, because taking it fully meant acknowledging how much she'd needed it. She drank the coffee. She picked up her first chart. She started her shift. The morning was busy in the ordinary way. A construction worker with a fractured radius, a teenager with a severe asthma attack that required 2 nebulizer treatments, and a lot of patience. An elderly woman whose daughter was more frightened than the patient was and needed more management than the medical situation did. Emily moved through all of it with the even-keeled attention that Linda had, on more than one occasion, described as detached, in tones that implied it was a character flaw. Linda was in at 8:30. She didn't speak to Emily directly. She spent the first hour of the shift visibly managing the unit with the heightened performance of someone demonstrating competence for an audience they suspected was watching, though Emily couldn't identify who specifically Linda thought was watching. The military men from the previous day were gone. The vehicles had cleared out around midnight, according to the night shift nurse Emily had spoken to briefly at handoff. except not entirely gone, as it turned out. At 11:15, Commander Ellis Varga walked through the ER's main entrance wearing civilian clothes, dark jeans, a gray jacket, nothing that marked him as military unless you knew what you were looking at, and Emily knew. He moved through the waiting area like he had coordinates already programmed. He stopped at the nursing station and asked, with the direct economy of a man who had never learned to make small talk and had decided not to start, "Is Emily Carter working today?" The nurse at the station, a second-year named Priya, who had never encountered anything quite like Ellis Varga, looked momentarily uncertain and then, to her credit, checked the schedule rather than just saying yes or no based on his face. "She is. Did I ask what this is about?" "Personal visit. I was a contact person for a patient she helped treat yesterday." Priya paged Emily. Emily came around the corner from the IV bay and saw him standing at the station and felt, for a fraction of a second, the old reflexive read that her nervous system ran on people she'd worked around in certain contexts: threat assessment, posture analysis, the automatic cataloging of exits. It ran in about 2 seconds and came back neutral. That wasn't a threat. He was a man who wanted something, and she had a reasonable idea of what it was. "Commander," she said. He nodded. "I won't take much of your time. Senior Chief Webb is awake and asking to speak with you. His surgical team has cleared a brief visit if you're available." "I'm on shift. I spoke with Dr. Takahashi. He's cleared 45 minutes. Of course he had. Emily looked at Varga and thought, not for the first time, that the world was considerably smaller than it appeared when you were standing in the middle of it. "Okay," she said. They walked to the ICU together without much conversation. Varga walked the way he'd stood at the gurney the previous day, with a specific, contained alertness that wasn't threatening but wasn't relaxed either. In the elevator, he said, "You never told anyone here about your background?" "No." "Why not?" Emily looked at the elevator doors. "Because I came here to do a different job. Not to be impressive, just to do the job." He absorbed that. The elevator opened on the 3rd floor. "Webb's going to want to say some things," Varga said. He feels strongly about the people who've helped him. Let him say them." Emily looked at him sideways. "Was that a warning?" Something crossed his face, not quite a smile, but adjacent to one. "More of a heads up." Room 4 of the ICU was quieter than the rest of the floor, its window looking out over the hospital's courtyard. Senior Chief Petty Officer Marcus Webb was propped at 30 degrees, IV lines running into his left arm, a nasal cannula providing supplemental oxygen. He was broad-faced and dark-haired and had the particular combination of pallor and alertness that came from someone who'd lost a significant amount of blood and was now running on the very stubborn determination not to let that define their situation. He looked at Emily when she came through the door, and the expression on his face was not one she was entirely prepared for. Not gratitude exactly, but recognition, the kind that came from one specific kind of experience and couldn't be faked or performed. "You kept me here," he said. His voice was rougher than she expected. The intubation during surgery had left its mark. "I helped buy some time," Emily said. "The surgical team kept you here." "You'd be surprised how much time matters." He shifted, winced slightly, and stabilized. "Ellis said you identified the lateral bleed. It was visible in the drainage pattern." "In how long?" She paused. "Maybe 40 seconds. Webb was quiet for a moment. His eyes were dark and direct and very awake. "I was conscious for longer than they might have told you. I heard what was happening in that room. I heard you talking to the other doctor, heard the resistance you got before they listened." He paused. "And I heard the woman who told you to step back." Emily didn't say anything. "I want to know something," Webb said, "and you don't have to answer, but I want to ask." "Okay." He gestured slightly toward her arms, the sleeves she'd pushed up at some point during the morning's work and hadn't pulled back down. "How?" The room was very quiet. Varga was standing near the window, ostensibly looking at the courtyard, giving her the privacy of his back. Emily looked at the scars for a moment, the rope-like lines, the flatter patches, the places where the damage had gone deeper than it looked from the surface. She'd had them for 3 years. She'd had a long time to get used to looking at them. "Apartment fire," she said. "Building on the south side of Ames, 2021. The sprinkler system had been flagged for maintenance and nobody had gotten to it yet. I was off duty. I was 2 blocks away." She didn't elaborate. She didn't say how many people she'd gone back in for. She didn't describe the stairwell or the heat or the ceiling she'd been under when it partially gave way. She didn't say any of the things that the incident had contained because saying them meant carrying them in words, and she preferred to carry them in silence, where they at least stayed compact. But Webb looked at her with the expression of someone who had heard enough to fill in what she'd left out, and his jaw tightened in a way that had nothing to do with his surgical pain. 5 people, Varga said quietly, from the window, without turning around. We pulled the incident report when your name came up yesterday. 5 civilian casualties prevented. Emily looked at his back. You were thorough. We usually are. Webb said, the scars? They give you grief here? People say things? She considered giving him the diplomatic version, but he'd asked a direct question, and she was a person who answered direct questions directly when she chose to answer them at all. The charge nurse uses them to establish that I don't belong in critical care. The quality of the silence that followed that sentence was specific in a way she noticed. Varga had turned away from the window. Webb's expression had settled into something that wasn't anger exactly, but was the precursor to it. The particular stillness of a person who has heard something that requires a response and is deciding what kind of response it warrants. She says that, Webb said, flat. In various ways, yes. To your face. And adjacent to it, when she wants deniability. Webb looked at Varga. Something passed between them. Wordless, quick, the shorthand of people who had worked together long enough that full sentences were sometimes unnecessary. Varga gave a small nod. I want to be clear about something, Webb said, looking back at Emily. What you did in that trauma bay, the way you moved, the way you called the bleed, the way you stayed through the whole thing and talked to me even when I probably wasn't processing all of it. That's not nursing school competency. That's something else. He paused. And someone using your scars to push you out of critical care is using the evidence of your courage to argue you lack it. I want you to know that I see that for what it is. Emily didn't respond right away. There was something about hearing it said plainly, not offered as comfort, but stated as a factual observation, that landed differently than sympathy would have. Thank you, she said. And then, because she meant it, I'm glad you're okay. She was at the door when he said, Ms. Carter. She stopped. Don't let them make you disappear. His voice was matter of fact, like he was reminding her of something she already knew but needed to hear again. People like you, the ones who run toward the problem. We can't afford to lose you to people who are afraid of what you represent. She didn't say anything to that. She pressed her palm briefly against the doorframe, not a gesture she'd planned, just something her body did, and walked back out into the corridor. Varga fell into step beside her without being asked. They walked back toward the elevator in silence for a moment before he said, There's something you should know. She looked at him. Webb is going to want to do something when he's out of here, when he's back on his feet. He's not the kind of man who receives help and moves on without acknowledging it. That's not criticism. It's just accurate. He already acknowledged it. So in here, yes. Varga pressed the elevator button. I mean more publicly. Emily felt something in her chest tighten. I know you don't need it. He said it without inflection, cutting off the sentence she was building without being rude about it. But he's going to want to give it anyway, and in my experience, it's easier to let Marcus Webb do the thing he wants to do than to try to talk him out of it. The elevator arrived. Emily got in. Varga held the door for a moment, not getting in himself. One more thing, he said. The woman who told you to step back. Brooks? Emily looked at him. Yes. We're going to make some inquiries. About the unit, the staffing practices. Standard process when our personnel are treated in a civilian facility. His tone was entirely neutral. If anything comes up that's relevant to the quality of care our people received, we'd want to know about it. That's a very careful way of saying something, Emily said. The corner of his mouth moved. We're careful people. He let the elevator door close. She came back to the floor and slid back into her shift without ceremony, picked up the chart she'd left, and kept moving. Priya glanced at her when she came back to the station, with the expression of someone who wanted to ask what the last 45 minutes had contained and was trying to decide if it was appropriate. Emily answered the unasked question by the simple method of not addressing it and starting on the next item in her queue. Linda noticed her return. Linda noticed most things on her unit. It was one of the reasons she'd maintained her position for 11 years, regardless of how she'd maintained it. She didn't say anything immediately, but Emily felt her attention the way you feel the specific weight of being watched by someone who is constructing something and waiting for the right moment to deploy it. The moment came at 3:15 during shift transition prep, when Linda called a brief team meeting at the nursing station to review the patient board. Standard practice, nothing unusual about the format. What was unusual was that Linda, at the end of the normal unit business, held up a printed page and said, "I also want to address a personnel matter that affects team cohesion." Emily was standing at the edge of the gathered nurses. She felt the direction of the room shift. Some of you may be aware that there were unauthorized interventions by a team member yesterday, both in a pediatric bay and in the trauma unit. I want to be clear that regardless of outcome, unauthorized deviations from assignment protocol create liability for this unit and for this hospital. Linda looked around the group, which meant she managed to look at everyone except Emily. The appropriate documentation has been filed. I want everyone to review their role assignments before tomorrow's shift. It was very smooth. It was the kind of thing that sounded like institutional responsibility and was actually personal. The nurses dispersed. Most of them didn't look at Emily directly, not out of cruelty, but out of the particular discomfort of being present for something they didn't know how to navigate. Nadia Ose was the exception. She caught Emily's eye across the station and gave her a look that communicated with considerable efficiency, both solidarity and the recognition that there was nothing useful Nadia could do about this particular moment. Emily nodded at her. Nadia nodded back. Emily finished her documentation, did her end-of-shift handoff to the night nurse, and was heading for the locker room when she heard raised voices from the direction of the administrative corridor. Not a patient issue. The quality was wrong for that. Too controlled, too institutional. She paused at the corridor intersection, not deliberately eavesdropping, but unable not to hear, because one of the voices belonged to Dr. Takahashi, and the other, she realized after a moment, was a woman she didn't recognize. The words were not fully clear, but the phrase naval medical coordination was clear enough, and the phrase patient care records from yesterday's trauma activation was clear enough, and the particular quality of Linda Brooks's voice, also audible, tighter than its usual controlled register, saying something about standard unit protocol, was very clear indeed. Emily stood at the intersection for 3 seconds. Then she kept walking. She changed out of her scrubs, put her jacket on, retrieved her bag from her locker, and went to the parking lot. The evening was cooler than the night before. She sat in her car without starting it for a moment, working through what she'd heard against what Varga had told her in the elevator. Standard process when our personnel are treated in a civilian facility. She started the car. She drove home. She made dinner this time, actual dinner, not toast, and sat at her kitchen table and ate it slowly, because there was something about this particular evening that told her rest was worth protecting while she still had access to it. Her phone buzzed at 8:47. A text from a number she didn't recognize, 4 words. Records request filed today. She stared at it. No signature, no context, no explanation of how anyone had gotten her personal number. She thought about Varga saying we're careful people, and thought about the particular specific kind of careful that implied. She set the phone down, picked it up again, set it down. Then her front doorbell rang. Emily went still. She was not the kind of person who lived in fear of her front doorbell. She was not the kind of person who lived in fear of most things at this point. But it was 9 o'clock on a weeknight and she was not expecting anyone. And the combination of the text and the timing made the hairs on her forearms rise in the way they hadn't risen since a different part of her life. She went to the door, looked through the peephole. On her front step, in the porch light, stood Linda Brooks. Emily opened the door. Linda was not in scrubs. She was in street clothes, dark slacks, a light jacket, her hair still pulled back the way she kept it on shift, but looser, like she'd driven here directly from the hospital without stopping to fully decompress from the day. She looked, for the first time since Emily had known her, like a person instead of a position. She also looked like someone who had not entirely decided what she was going to say. "I'm not here officially," Linda said. Emily looked at her. "Okay. Can I come in?" Emily considered it for exactly the length of time it took to read Linda's posture. Tense, contained, the particular stiffness of someone who had done something they couldn't undo and had come to deal with the fact rather than flee from it. She stepped back from the door. Linda came in. She looked at the sparse living room, the books, the minimal furniture, the complete absence of personal photographs or decoration, without commenting on it. Emily didn't offer her anything. She stood in the middle of her own living room and waited. "The Naval Coordination woman," Linda said. "Winslow. She was at the hospital this afternoon." "I know." She pulled the incident report on yesterday's trauma activation. The full chart. The nursing notes, the physician notes, the documentation of every intervention made in Bay 1. Linda paused. "Including mine." Emily waited. "My note," Linda said, "documented that I attempted to redirect an unauthorized staff member during a critical procedure and that the trauma physician overrode my direction." She said it with the careful flatness of someone reciting something they've already replayed many times. "That's accurate. That's what I wrote, and that's what happened." "Yes." "What I didn't put in the note was that Webb's pressure had dropped to 68 systolic before your lateral bleed identification, or that it recovered to 91 within 4 minutes of the intervention." Linda's jaw worked for a moment. "Winslow found that in the monitor log, the timestamps." Emily said nothing. "She also found the PIP I filed on you this morning." Linda looked at her. "And the one from 6 weeks ago. And the disciplinary note from your 3rd week here." The room was very quiet. Outside, a car passed on the street. "Why are you telling me this?" Emily said. Linda looked at the floor for a moment, which was the first time Emily had ever seen her look at anything other than the person she was addressing. "Because I think I made a series of decisions this week that I can't walk back. And I want you to know that I know that." She looked up. "That's all. I'm not asking for anything." Emily studied her. Linda was not a woman who apologized. Emily had worked with her long enough to be certain of that. This was something different from an apology. It was closer to a person standing at the edge of a consequence they'd created for themselves and looking down. "Is there anything else?" Emily said. Linda was quiet for a moment. "You're not going to tell me I should have handled it differently." "You know you should have handled it differently." "Yes." A pause. "I do." She moved toward the door. Her hand was on the handle when she stopped. "The scars. I used them as... I told myself it was about competency, about who belonged in trauma." "You told yourself that?" "Yes." Linda opened the door. The night air came in, cool and sharp. "It wasn't." She left. Emily closed the door behind her and stood in the quiet for a long time. She didn't know what Linda's visit meant in any practical sense, whether it would change the PIP, change the documentation, change anything that was already in motion. The records request was filed. Whatever Winslow's office was looking for, they were already looking for it. Linda coming to her house at 9 o'clock on a weeknight was a human gesture, and human gestures mattered in ways that were difficult to quantify, but they didn't erase paperwork. Emily went to bed. She slept better than she expected to. The next 3 days had the particular quality of a situation that was escalating on multiple levels simultaneously, while the surface of daily life remained nearly unchanged. Emily worked her shifts. She did her assessments, administered medications, managed her patients with the steady competence that had brought her to nursing in the first place. She restocked carts when Linda asked her to. She stayed in her assigned bays. She did not deviate from her roll sheet in any visible or documentable way. She also, quietly, began to notice things. She'd always noticed things. It was not a skill she'd acquired at Riverside, it was one she'd walked in with. But she began to pay deliberate attention to the unit's patterns in a way she hadn't before. Who Linda redirected and when. Which cases got assigned to which nurses and on what basis. Which incident reports were filed and which near misses were absorbed into the unit's ambient noise without documentation. She started keeping notes in a small notebook she'd bought at the pharmacy 2 blocks from her house. Not anything dramatic, just times, dates, the factual content of exchanges she witnessed or was part of. It was the kind of documentation that a person with a legal or investigative background would recognize as methodical. And it was the kind of thing that Emily had learned to do a long time ago in a context where documentation was the difference between a problem getting addressed and a problem getting buried. On the second day, Nadia Ose found her in the break room during a 15-minute gap between patient loads and sat down across from her with the expression of someone who had been thinking about something for a while and had decided to stop thinking and start saying. 3 nurses have filed complaints against Linda in the past 2 years, Nadia said. No preamble. Emily looked at her. How do you know that? Because one of them was my resident cohort supervising nurse before she transferred to county. She told me. Nadia wrapped her hands around her coffee. The complaints went to the unit director, Holloway, and Holloway documented them as interpersonal conflicts and closed them out. No escalation, no investigation. Did the nurses push it further? One of them did. HR told her the investigation was complete. Nadia paused. She left 6 months later. Emily processed this. Why are you telling me? Because there's a naval coordination officer asking questions in the administrative corridor, and Linda has been walking around for 3 days looking like someone who knows something is coming. Nadia looked at her directly. And because whatever you did in Bay 1 that day, whatever that actually was, I'd rather it be on the record correctly than buried in a PP file. Emily was quiet for a moment. What are you thinking about doing? I wrote my own statement about what I observed in the pediatric bay the morning before the trauma activation, my clinical assessment of the intervention and the outcome. Nadia set her coffee down. I gave it to Winslow. Emily looked at her. She came to you? I went to her. Nadia shrugged, but it wasn't a casual shrug. It was the kind that contained a decision that had been made and committed to. I'm a resident. Linda can't really touch me without Takahashi knowing about it. I had less to lose. You had something to lose? Less. Nadia stood up. You should know. I wasn't the only one she talked to. Priya gave a statement, and the night shift charge nurse, Bertoli. Linda wrote him up twice last year, and he's been waiting for an opportunity. Emily sat with that for a moment. The particular feeling it produced was difficult to name. Not vindication, because nothing had been resolved yet, and not relief, because the situation was still very much in motion. Something closer to the recognition that she had not been as invisible as she'd believed herself to be, and that the people around her had been paying attention in their own ways. Thank you, she said. Nadia picked up her coffee. Don't thank me, just don't disappear. It was nearly the same thing Webb had said. Emily thought about that as she walked back to the floor. On the third day, Marcus Webb was moved out of the ICU. He was transferred to a standard recovery room on the 4th floor, still monitored, still restricted in activity, but no longer in the unit's controlled environment. Emily heard about it from Priya, who had apparently gotten the update from the 4th floor charge nurse, which was the kind of information travel that happened in hospitals, where everyone knew everyone, and gossip moved faster than the chart system. She didn't go up. She had no clinical reason to go up, and she was being deliberately careful about anything that could be documented as overstepping. But at 4:30, near the end of her shift, her pager went off with an internal extension she didn't recognize. She called it from the nursing station phone. Carter, Varga's voice. Room 412. When you're off. Why? Because Webb wants to talk, and I told him I'd relay the message. You don't have to come. She went. Room 412 had 2 chairs and a window view of the parking structure, and Marcus Webb, sitting up in bed looking considerably more alert than he had 2 days ago, which was both encouraging from a medical standpoint and slightly unnerving because his alertness had a focused quality that suggested he'd been thinking about things he intended to say. Varga was standing near the window again. Emily was beginning to understand that the window was where he went when he wanted to be in a room without actively occupying it. They cleared me for discharge Friday, Webb said, which means I'll be out of your hair. You're not in my hair. The situation I've apparently kicked off might be. He didn't look apologetic about it, but he looked aware. Winslow's people have been here 3 days. That's longer than standard protocol for a routine records review. What does that mean? It means they found something. He said it simply, without drama. Winslow doesn't extend reviews without cause. She's methodical. If she's still here, it's because the documentation raised questions that the answers in the file didn't resolve. Emily looked at him. What kind of questions? Webb glanced at Varga. Varga said without turning from the window, the nursing notes for the initial trauma activation contain a gap. There's a 12-minute period where the documentation shows no active nursing intervention on the primary patient, which doesn't match the monitor log or the physician notes. Emily absorbed that. Linda's notes. Her shift, her documentation responsibility. Varga turned from the window. It could be an administrative error? People miss entries under pressure. But the physician notes are detailed and specific about what was happening in those 12 minutes. They include actions and observations that should have corresponding nursing entries. He paused. They don't. Emily thought about what Nadia had told her. The complaints filed closed out as interpersonal conflicts, the nurse who left. She thought about the notes in her small notebook, which were factual and undramatic and contained the specific timestamps she'd observed over 3 days of deliberate attention. There's something else, Varga said. One of the nursing statements given to Winslow mentioned a pattern. Systematic redirection of specific nurses from critical care assignments. Assignment manipulation based on, he paused, choosing the word carefully, subjective assessments of clinical suitability. Emily was quiet. If that pattern can be documented, he said, it becomes a different kind of problem for this unit. Not an interpersonal conflict, a structural one. She thought about what to say to that and decided to say the thing that was directly true. I have notes. From the past 3 days, times, dates, specific instances. I can give them to Winslow. Varga looked at her. His expression didn't change. He had an excellent poker face, the kind that came from years of high-stakes work. But something behind his eyes shifted in a way she recognized as approval. I'll let her know, he said. Webb was watching her with the same focused attention he'd had since he woke up in the ICU. You started documenting on your own, he said, without being asked. It seemed like the right time to start. Most people would have kept their head down and hoped it blew over. I tried that for 4 months, Emily said. It didn't blow over. Something moved across Webb's face, rueful almost. No, he said. It never does. She gave Winslow the notebook the following morning. Not a copy, the original, with its dates and times and factual prose that had no editorializing in it anywhere, because Emily had learned long ago that the cleanest documentation was the kind that didn't need to argue its own case. Winslow received it without ceremony, read the first 3 pages standing in the administrative corridor, and said, I'll need a formal statement from you. Can you come in after your shift? Yes, Emily said. She went back to work. She did her shift with the same even attention she always brought to it. She did not look for Linda more than she normally would have. She did not avoid her either. Linda, for her part, was present and functional on the unit in a way that was almost aggressive in its normalcy, moving through her duties with the practiced efficiency of someone who had decided that competent performance was the best remaining strategy. She did not speak to Emily about anything unrelated to patient care. She did not assign Emily to supply runs or redirect her from any of her patients. It was almost worse than the open hostility, because it had the quality of someone very carefully not doing things, which was a specific kind of performance that required significant conscious effort. Something happened that nobody on the unit had scripted. The ambulance bay doors opened and a gurney came through at a run, standard enough, but behind it came a second gurney, and behind that, on her own feet but barely, a woman in her 60s who was talking rapidly in a language Emily didn't speak and holding her right arm at an angle that indicated fracture. The EMT crew was calling out a multi-vehicle accident from the interstate. 3 patients, 2 critical, 1 ambulatory but injured. Bays 1 and 2 were already occupied. Bay 3 had a patient midway through a procedure. The trauma team had assembled with the controlled urgency of people who had done this before, but they were thin. 2 nurses had called out sick, and the coverage was already stretched. Emily moved. She was already at the Bay 1 threshold before she consciously decided to go there. The patient on the first gurney was a man in his 40s with a significant chest injury, paradoxical breathing, the chest wall moving in the wrong direction with each breath, which Emily recognized immediately as a flail segment. Dr. Takahashi was 30 seconds behind the gurney. Flail chest, Emily said when he came through the door. He looked at the patient's chest wall, made the same read in about 2 seconds. Yeah, talk to me about breath sounds. She was already there with the stethoscope. Diminished right lower, not absent. Pneumo? Maybe small. He's compensating. Takahashi was already moving. I need him on high flow O2 and I need someone at his head. Where's Marcus? Marcus was the respiratory tech. Marcus was, at that moment, dealing with the second gurney. There was nobody at the patient's head. Emily positioned herself. She managed the airway, tracked the breathing, fed Takahashi the information he needed as he worked, not anticipating, not overstepping, but moving in the specific practiced lockstep of someone who had worked alongside trauma physicians in environments where communication had to be fast and clean and exactly calibrated to what the doctor in front of her needed. Takahashi didn't question it. He worked. She worked. The patient's oxygen came up. The chest wall motion stabilized as Takahashi initiated the intervention. 14 minutes. The patient was stable enough for imaging. Emily stepped back. Takahashi stripped off his outer gloves and looked at her for a long moment. "You've worked a trauma bay before," he said. It wasn't a question. "I've worked some difficult environments," she said. "What were you doing in those environments?" She looked at him steadily. "Medical support." He held her gaze for exactly as long as it took to decide to let it go. "Okay," he said. "Go check on Bay 2. She went. She was at the Bay 2 doorway when she heard from behind her a sound that stopped her completely. It was the sound of footsteps, multiple sets, coordinated, moving down the main corridor with a rhythm that was not the irregular shuffle of hospital foot traffic, but the specific, measured cadence of people moving together with shared purpose. She turned. There were 6 of them. Marcus Webb was not supposed to be out of his room. He was on day 4 post-surgery, cleared for limited ambulation with supervision, not for walking the length of the hospital. But there he was, at the front of the group, moving carefully but under his own power, wearing the Navy service uniform that someone must have brought him because he hadn't arrived in it. Behind him were 5 men Emily recognized, not by name, but by bearing, by the way they moved, by the cut of their uniforms. Varga was not among them, which she registered as significant in a way she couldn't immediately explain. The corridor, which had been at the controlled pitch of active emergency response, went quiet in the specific way that spaces go quiet when something unexpected walks into them. Webb stopped in the middle of the corridor, 15 feet from where Emily was standing. His face was pale. The walk had cost him something, but his posture was straight and his eyes were clear and direct. He looked at her. Then, with the careful deliberateness of someone who had been thinking about this moment for several days and intended to do it correctly, Senior Chief Petty Officer Marcus Webb came to attention and saluted. The 5 men behind him came to attention in the same instant, precise and simultaneous, the way that years of training made things simultaneous. 6 right hands at 6 foreheads held steady in the middle of the hospital corridor. The trauma bay. Emily was silent. The nursing station was silent. Somewhere down the hall, someone had stopped moving. "She ran toward the fire," Webb said. His voice carried in the quiet with no effort at all. "When the building was coming down and everyone else was running out, she ran in, 5 times. He didn't look away from Emily. "That's not something you see every day. That's something you remember for the rest of your life." Emily stood very still. She was aware peripherally of the people around her. Nadia, near the nursing station, her expression open in a way she usually kept controlled. Priya, who had stopped mid-step in the corridor and was standing with both hands at her sides. Dr. Takahashi, at the Bay 1 entrance, watching with the quiet attention of a man who recognized significance when it was in front of him. And Linda. Linda Brooks was standing at the corridor junction 20 feet away, a tablet in her hands that she'd clearly been carrying somewhere when the moment happened. She had the expression of someone who had been struck by something and hadn't yet fully registered what it was. Her face was doing several things at once and managing to resolve none of them. Webb held the salute for 10 full seconds. Then he lowered his hand, and the 5 men behind him followed in the same instant. Emily looked at him. Her throat was tight, which she'd been expecting, and her hands were steady, which she'd also been expecting, because her hands were always steady. She felt the complex weight of being seen in this particular way in this particular place, the place that had spent 4 months making her feel like a liability. "Thank you," she said. Her voice came out level. She was glad of it. Webb's expression was serious and direct and carried underneath it a warmth that he didn't perform. "No," he said. "Thank you." He turned and his team turned with him, and they began the careful walk back toward the elevator. One of the men, the shortest one, who had a scar above his left ear that suggested his own history of difficult situations, glanced back at Emily as they went and gave her a single nod that contained a complete and unambiguous message. The corridor stayed quiet for several seconds after they'd gone. Then someone, Emily never found out who, started clapping. Not loud, not theatrical, just one person, and then another, and then the sound moved through the corridor the way things move through spaces when they're real and not performed. And Emily stood in the middle of it and let it happen, because Webb had told her to let people do the thing they needed to do. She looked once toward the corridor junction where Linda had been standing. Linda was gone. Winslow's office was a conference room on the second floor that the hospital had temporarily given over to the Naval Coordination Review. It had a folding table and 4 chairs and a window that looked at the parking structure. And when Emily arrived after her shift, it contained Winslow, compact, 50s, with the economical manner of someone who had spent a career distilling complex situations into actionable information, and a man Emily didn't recognize who was introduced as a legal liaison from the hospital's administrative board. She gave her formal statement. It took 40 minutes. Winslow asked precise, specific questions that told Emily, by their shape, what the review had already established and what it still needed to confirm. The legal liaison took notes without commenting. Emily answered everything directly and without embellishment, because embellishment was the enemy of a clean record. When it was done, Winslow set down her pen. Ms. Carter, the review has identified several areas of concern that extend beyond the immediate patient care question. She said it with the neutrality of a person delivering a factual assessment. The documentation irregularities, combined with the pattern of assignment practices and the disciplinary history of the complaints that were previously closed without investigation, constitute a picture that the hospital board is going to need to address formally. What does that mean practically? Emily asked. It means the file goes to the board tomorrow morning. Winslow paused. And it means that the recommendations coming out of this review will be specific and binding. Emily was quiet for a moment. How specific? Winslow looked at her with the expression of someone who was about to say something they weren't technically required to say, but had decided to say anyway. Specific enough that the people responsible for what happened in this unit are going to have to account for it, including people above the charge nurse level. The legal liaison looked at Winslow. Winslow didn't look back at him. Emily absorbed that. Holloway, she said. The unit director who had closed out the previous complaints as interpersonal conflicts. Winslow said nothing, which was, itself, a complete answer. Emily walked out of the conference room at 8:40 and took the stairs down to the ground floor because she needed the movement, the concrete physical fact of her feet on the steps, the railing under her hand. She pushed through the stairwell door into the main corridor and nearly walked directly into Varga, who was standing in the corridor with his jacket on and his hands in his pockets and the look of a man who had been waiting for a specific thing and had timed his wait correctly. Board meeting is 8 a.m., he said. I know. You should be there. Am I required to be? No. A pause. But you should be there. She looked at him. What's going to happen? Varga was quiet for a moment. The specific quiet of someone measuring what they knew against what was appropriate to share. The review findings are thorough, he said finally, and the board has had the preliminary report since this afternoon. I spoke with the board chair at 6 o'clock. And I've seen boards move slowly, and I've seen boards move fast, and this one is going to move fast. He held her gaze. Be there, Carter. 8 a.m. He walked past her toward the exit, and Emily stood in the corridor alone for a moment, thinking about what fast meant in this context and what it meant for her, specifically, and what it would mean to be in a room at 8 a.m. watching the consequence of the past 4 months arrive at its conclusion. Her phone buzzed. She looked at it. A text from a number she now recognized as Winslow's. Addendum to review filed at 2032. You'll want to know, Brooks submitted her resignation at 1945. Emily read it twice. She put her phone in her pocket. Then her pager went off. The hospital pager, the one she carried on shift. And the code on the screen was one she recognized immediately, because she'd been a nurse long enough that certain numbers became reflexive knowledge. The code for a crash, and the room number attached to it was 412. Webb's room. Emily was already moving before she finished reading the room number. She took the stairs because the elevator was too slow and she knew it from 4 months of working this building. 3 flights, the stairwell door on 4 banging open under her palm, her shoes hitting the linoleum at a pace that wasn't quite a run and was everything short of 1. The corridor was already activating. She could hear it before she reached it, the overhead page repeating the code, the rattle of a crash cart being pushed at speed, the particular pitch of voices that had shifted out of conversational register and into something clipped and functional. Room 412's door was open. 2 nurses were already inside. Marcus Webb was flat on his back with the bed rails down and the head of the bed dropped, and the monitor above him was showing a rhythm that Emily read in under 2 seconds. Ventricular tachycardia. Fast. Wide. Not the kind that held. The 4th-floor charge nurse was a heavy-set man named Torres, who moved with the specific unhurried economy of someone who had run enough codes that adrenaline no longer improved his performance. He had 2 fingers on Webb's carotid and his eyes on the monitor. "No pulse," he said. "Starting compressions. Get the pads on him." Emily was already at the cart. She pulled the defibrillator pads, tore the packaging, and had them on Webb's chest. 1 anterior, 1 lateral, clear of the surgical dressing, inside 20 seconds. The other nurse, a younger woman Emily didn't know by name, was doing compressions with good depth and terrible rhythm. Too fast, the way people did when they were frightened. "Slow it down," Emily said. Not unkindly. "Count out loud." The nurse counted. The rate came down into something useful. "Charging," Torres said. "Everybody clear." The shock went in. The monitor scrambled, settled, and produced something that was not a rhythm anyone wanted. A disorganized electrical pattern with no mechanical output behind it. "PEA," Torres said. "Resume compressions. Epi's going in." Emily's mind was running faster than the room was. She had been in room 412 2 days ago. She had looked at this man's chart when she had no clinical reason to, and had noted, because she noted things, that his post-operative course had been unremarkable. She had seen him walk the length of a hospital corridor 8 hours ago, which he had not been cleared to do, and she had watched him hold a salute for 10 seconds without wavering. 8 hours ago, he had been fine. She looked at his neck. The jugular veins were distended in a way that shouldn't have been possible in a man who had just lost his pulse. She looked at the monitor's last recorded blood pressure before the arrest, 82/51, taken 40 minutes earlier, which was low for Webb, and which somebody had presumably seen and had not escalated. "Torres," she said, "where's the on-call?" "Paged. 2 minutes out." "He needs to be here now." She kept her voice level, which took effort. "Look at his neck." Torres looked. His compressions didn't stop, but his face changed. JVD. And the pressure trend before the arrest was going down for at least an hour. "You think tamponade?" "I think something's filling a space that shouldn't have anything in it." Emily was already reaching for the ultrasound cart, which was parked against the wall. The way ultrasound carts were always parked against walls in hospitals, where nobody had time to put them back properly. He had a chest and upper abdominal repair 4 days ago. If he had a slow bleed into the pericardial sac, this is exactly what it would look like. That's a surgical call. Then we need a surgeon in this room in the next 90 seconds. The on-call physician arrived at that moment, Dr. Alia Brandt, internal medicine, competent and entirely out of her depth for what was in front of her. She took in the room, the monitor, the compressions, and said, "What have we got?" "Post-op day 4, chest and abdominal repair, arrested in VTAC, now PEA, JVD present, hypotensive trend for at least an hour before the arrest," Emily said. "There's a nurse getting the ultrasound. I want a cardiac window." Brandt looked at her for half a second. The specific half-second in which a physician decides whether to be territorial about who is giving direction in their code, and then made the correct call, which was to not waste it. "Do it," she said. "Where's the surgical team?" "Paging now," Torres said. Emily got the probe into position under the sternum while compressions continued, which was awkward and imperfect and required Torres to lift on the upstroke so she could catch a window between them. It took 4 attempts. On the 4th, during a 2-second pause in compressions, the image resolved into something that made Brandt inhale sharply. The pericardial space was not a space. It was a dark rim of fluid compressing the right ventricle inward with each attempted contraction, the chamber collapsing under a pressure it could not overcome. "Tamponade," Brandt said. "Confirmed. I need a surgeon." "Vance is in the building," Torres said. "He was scrubbing for an appy." "Then he's not scrubbing for an appy anymore." What happened over the following 11 minutes was not smooth and did not look like anything from a medical drama. Dr. Vance arrived in scrubs with his mask hanging off one ear and had to be told the situation twice because the first version, delivered by an intern who had wandered in at exactly the wrong moment, was wrong. The pericardiocentesis kit was in the wrong drawer of the cart. Emily found it in the drawer below the labeled one, which was the kind of small institutional failure that mattered enormously at exactly the wrong times and was invisible the rest of the year. Vance got the needle in on the second attempt. The first pass was too shallow, which he said out loud, because he was the kind of surgeon who narrated his errors rather than hiding them. 60 milliliters of blood came off, then another 40. The monitor changed, not dramatically, not with the sudden clean conversion that people imagined. It went from disorganized electrical activity to a slow, wide, wounded-looking rhythm that Torres, with 2 fingers on the carotid, confirmed was producing an actual pulse. "I've got output," he said. "He needs an OR right now," Vance said. "Whatever's bleeding into that sac is still bleeding into that sac. This buys us 15 minutes. They moved him. The transfer down the corridor was fast and slightly chaotic, and involved a moment where the IV pole caught on the doorframe and someone swore, and Emily walked at the head of the bed, managing Webb's airway with a bag valve mask because there was nobody else free to do it, and because she had done it several hundred times in places she did not talk about. At the OR doors, Vance looked at her over the gurney. "Who called the tamponade?" Torres, who was on the other side, said, "She did." Vance looked at Emily for a beat. "Good," he said, and then the doors swallowed the gurney and Emily was standing in the corridor with a bag valve mask still in her hand and nothing else to do. She stood there for a while. The surgery took 2 hours and 40 minutes. She learned this the way she learned most things, by being in the building and paying attention. She did not go home. She sat in the 4th-floor family waiting area, which was empty at that hour, except for a vending machine that hummed at an irritating frequency, and she waited. And at 11:52 p.m., Commander Ellis Varga came around the corner and sat down 2 chairs away from her without asking whether that was all right. "He's out," Varga said. Vance found the source. Suture line on a branch vessel gave way. Slow bleed probably started sometime this afternoon. Emily closed her eyes briefly. "How's his function?" "They think he'll be..." He was down for a short time and they got him back with output. Vance seemed cautiously optimistic, which from what I understand is as close to celebrating as that man gets. "That's about right." Varga leaned forward, elbows on his knees, and looked at the floor. "Carter, I want to ask you something and I want a direct answer." "Okay." His pressure was trending down for over an hour. Somebody took that reading. Somebody documented it. He turned his head to look at her. "Why didn't anyone escalate?" Emily had been thinking about that question for 2 hours and 40 minutes. "The 4th floor was running 2 nurses short tonight," she said. "Torres told me while we were cleaning up. 2 call-outs, no float coverage approved." "Approved by who?" "Staffing requests over a certain threshold go to the unit director for authorization." Varga was quiet for a moment. "Holloway." "Holloway." He sat back. His face didn't change much, but there was something under it now that Emily recognized as the beginning of a very specific kind of anger. The controlled kind. The kind that got filed rather than shouted. "You understand what you're saying," he said. "I'm saying a man nearly died tonight from a complication that should have been caught by a trend that nobody had time to look at, on a floor that was 2 bodies short because filling those bodies would have shown up on a budget line." Emily's voice was flat. "I'm not saying anyone intended it. I'm saying it happened." "That's worse," Varga said. "Yes," Emily said. "It usually is." The board convened at 8 the next morning in a conference room on the 6th floor that Emily had never had reason to enter in 4 months of employment. It had a long table and 11 chairs and a bank of windows that looked out over the flooded corner of the parking lot where it always flooded, and it smelled like the industrial carpet cleaner they used on the administrative floors. Emily arrived at 7:52. She had gone home at 1 in the morning, slept for 4 hours, showered, and put on the only professional clothing she owned that wasn't scrubs. Dark slacks, and a plain gray blouse with sleeves that came to her wrists. She noticed herself choosing the long sleeves. She noticed herself noticing it, and then, standing in her bedroom at 6:40 in the morning, she rolled them up to the elbow and left them there. The room filled slowly. Dr. Takahashi came in at 7:56 and took the seat nearest the door with the expression of a man who had been called to a meeting he had opinions about. Nadia Ose was there, sitting very straight, in a position that suggested she had been asked to attend rather than choosing to. Lieutenant Commander Dara Winslow was already seated at the far end of the table with a folder in front of her that was thicker than Emily had expected. Varga stood against the back wall and did not sit. The board chair was a woman named Ruth Oyalaran, 60s, a retired hospital administrator who had come out of retirement to chair the Riverside board and who had, according to hospital rumor, taken the position on the explicit condition that she would not be a figurehead. She opened the meeting at 8:01 by saying, "Let's not do the preamble. Commander Winslow, the floor is yours." Winslow opened the folder. This review was initiated as a standard post-treatment records request, following the emergency care of a service member at this facility on the 14th, she said. Standard requests take approximately 6 hours. This one has taken 6 days because of what the records contained. Nobody in the room moved. I'm going to lay out 3 findings. They are separate and they compound. She turned a page. First, the nursing documentation for the initial trauma activation on the 14th contains a 12-minute gap, during which the physician record documents active intervention and the monitor log documents a hemodynamic recovery. There are no corresponding nursing entries. When I requested clarification, the charge nurse of record, Ms. Brooks, stated that the entries were made and subsequently lost to a charting system error. Oyalaran said, "Was there a system error?" I'd confirmed no interruption of the charting system on the 14th. Winslow did not editorialize. The entries were not made. The man sitting to Oyalaran's left, the hospital's general counsel, whose name Emily didn't know, wrote something down. Second finding, Winslow said. In reviewing personnel documentation attached to the same period, I identified 3 formal complaints filed against Ms. Brooks by nursing staff over the preceding 24 months. All 3 were routed to the unit director, Mr. Dennis Holloway. All 3 were closed within 9 days, categorized as interpersonal conflict, and were not escalated to human resources or to this board. Were the complainants notified of the outcome? Oyalaran asked. They were notified that the matter was resolved. They were not provided findings because no findings were produced. No investigation was conducted. Emily watched Oyalaran's face. It didn't do anything dramatic. It just got very still, which was worse. Third finding, Winslow said, concerns last night. The room's attention sharpened. At approximately 20:50, the service member who was the subject of the original records request suffered a cardiac arrest secondary to delayed pericardial hemorrhage. He was resuscitated and taken to emergency surgery. He is stable this morning. Winslow paused. His blood pressure had been trending downward for a documented period of 68 minutes prior to the arrest. The trend was recorded. It was not escalated. The floor was operating 2 nurses below its own minimum staffing matrix. Why? Oyalaran said. Because the float coverage request submitted at 15:20 was denied at 15:44. By whom? Winslow looked up from the folder for the first time. By Mr. Holloway. Dennis Holloway was sitting 4 chairs down from Emily. She had seen him perhaps a dozen times in 4 months. A man in his 50s with a soft, agreeable face and a habit of saying, "We'll look into that," in a tone that closed conversations rather than opening them. He had not spoken since the meeting began. He spoke now. "That's a mischaracterization," he said. "Float requests are evaluated against census. The fourth floor census was at 91%, Winslow said. "I have the report." 91% doesn't automatically trigger. Mr. Holloway, Oyalaran's voice was not raised. You will have an opportunity to respond in full. Right now you will let her finish. Holloway stopped talking. The color had gone out of his face in a way that was visible from across the table. Winslow closed the folder. My recommendations are attached in full, she said. They are advisory to this board and binding on the Navy's side, which means this facility's designation for emergency receipt of military personnel is under review pending your response. I'll summarize the core of it. 1. The charge nurse of record must be separated from clinical supervisory responsibility and referred to the State Nursing Board for documentation irregularities. 2. The unit director must be separated from any role with authority over staffing or complaint disposition. 3. This facility must implement an independent complaint pathway that does not route through the unit under complaint. There was a silence. Ms. Brooks tendered her resignation at 19:45 last night, the general counsel said. I'm aware, Winslow said. A resignation is not a finding. It does not terminate the board referral, and it does not remove the conduct from her record. Oyalaran looked down the table. Mr. Holloway, you may respond. Holloway responded for 11 minutes. Emily listened to all of it. It was, in its way, a masterful performance. A man explaining the impossible position of budget stewardship, the constant pressure from above to control agency spend, the reality that every director in every hospital in the state made these calls a dozen times a week, and nobody noticed until one of them went badly. Some of it was even true. That was the part Emily found hardest to sit through, because the true parts made the rest of it more effective. When he finished, Oyalaran said, Mr. Holloway, did you ever investigate a single one of those 3 complaints? He hesitated. I spoke with the parties. Did you document those conversations? Informally. Where? He didn't answer. You closed 3 formal complaints against the same supervisor in 24 months without a documented investigation, Oyalaran said. That is not budget stewardship. That is the disposal of information you did not want to have. Holloway's mouth opened and closed. Thank you, Oyalaran said. You may go. He looked around the table as though expecting someone to intervene. Nobody did. Takahashi was looking at the window. The general counsel was writing. Holloway stood, gathered nothing because he had brought nothing, and left the room, and the door closed behind him with a soft click that seemed disproportionately loud. Oyalaran turned to Emily. Ms. Carter, she said, you've said nothing this entire meeting. I wasn't asked anything. You're being asked now. Oyalaran folded her hands. 4 months, 2 performance improvement plans, a disciplinary note in your 3rd week, reassignment away from critical care on more occasions than I can count from this file without a calculator. She tapped the folder in front of her. Why didn't you file a complaint? Emily thought about the honest answer and decided to give it. Because I watched what happened to the people who did, she said. The room was very quiet. I knew about 2 of the 3 complaints, Emily said. Not the details, just that they'd been filed and that nothing came of them and that one of those nurses isn't here anymore. So I made a calculation, which was that if I kept my head down and did the work, eventually the work would speak for itself. She paused. That calculation was wrong. I want to be clear that I know it was wrong. If I'd filed in my 3rd week, this board might have looked at Holloway's disposal pattern 8 weeks before a man arrested on the 4th floor, Nadia said quietly from 3 seats down. That's not on you. Some of it's on me, Emily said. Not most of it, some. Oyalaran looked at her for a long moment. That, she said, is the first thing anyone has said in this room this morning that took responsibility for anything. She turned to the general counsel. Draft the separations, both of them. Brooks's resignation is noted and not accepted in lieu of finding. The record reflects the finding. Holloway is terminated for cause effective immediately, and I want the referral to the state board filed for both by end of week. Yes, ma'am. And I want a public statement. Oyalaran's voice hardened slightly. Not a legal one. A real one. This hospital humiliated a nurse for the marks she got saving 5 people's lives, and then it nearly killed a patient because it wouldn't approve 2 float shifts. Both of those things are going to be said out loud, in plain English, by someone whose name is on this institution. The counsel looked pained. Ma'am, the exposure. The exposure is already here. She gestured at Winslow's folder. The only question is whether we're the ones who say it. Emily left the meeting at 9:40 and did not make it to the elevator. Linda Brooks was standing in the 6th floor corridor by the window, in a coat, holding a cardboard box that contained the contents of 11 years of an office. She had clearly been there for a while. She had clearly been waiting. They wouldn't let me in, she said. You resigned. I resigned. They still wouldn't let me in. She shifted the box against her hip. How bad? Emily considered lying and didn't. Board referral. The resignation doesn't stop it. Holloway's terminated for cause. Something moved through Linda's face. Not surprise. Something more like the settling of a weight into a place it had been hovering over. He's the one who taught me how to close a complaint, she said. That's not a defense. I know it's not a defense. Her voice sharpened, and then she visibly pulled it back, which was the first time Emily had ever seen her do that. I'm not offering it as one. I'm telling you a fact about how I got here, because I've had about 11 hours to think about how I got here, and it turns out I remember every step. Emily said nothing. You want to know the thing I keep coming back to? Linda shifted the box again. It's not the trauma bay. It's not the write-ups. It's that first week. You came onto my unit with those arms, and I decided in about 4 seconds what kind of person you were. She looked at Emily directly. And I was so completely wrong that I've spent 4 months making sure nobody found out. Emily absorbed that. You knew, she said. Not what you'd done. Not the fire. I didn't know that. Linda's jaw tightened. I knew you were better than me in a trauma bay. I knew it the first time I watched you run an assessment. And every time I put you on a supply cart, I knew exactly what I was doing. The elevator arrived. Neither of them moved toward it. The doors closed again. I'm not asking you to forgive me, Linda said. I want to be clear about that. I'm not going to stand in a hallway and put that on you. Good, Emily said. Because I don't. Linda nodded slowly. She didn't look wounded by it. She looked like someone hearing an accurate assessment. Fair, she said. She picked her box up properly and walked toward the elevator, pressed the button, and stood waiting with her back to Emily. Just before the doors opened, she said without turning around, The kid in Bay 5, the 8-year-old with the DSAT. A pause. You were right, and I knew you were right, and I wrote you up anyway. That's the one I'd take back. If I could only have one. The doors opened. She got in. They closed. Emily stood in the corridor by herself for a moment and found that she did not feel triumphant. She felt tired and clear, and something adjacent to sad. Not for Linda specifically, but for the sheer waste of it, for the 11 years and the 3 nurses and the 4 months and the man on the 4th floor whose suture line had let go on an understaffed evening while an administrator protected a budget line. Then she went downstairs and started her shift because she was on the schedule at 10. The hospital's statement went out at 4:12 p.m. It was 2 paragraphs long. It named the failures without hedging, a supervisory pattern that had gone uninvestigated, a complaint process that had routed complaints to the person best positioned to bury them, and a staffing decision that had contributed to a delayed recognition of a post-operative complication. It stated that 2 individuals had been separated from the institution and referred to their licensing board. It did not name Emily, at Oyalaran's specific instruction and with Emily's specific agreement, because Emily had asked and Oyalaran had said, of course, without needing the reason explained. The effect inside the building was immediate and strange. Emily walked through the ER at 4:15 and felt the atmosphere of the unit as a physical thing. People who had worked under Linda for years processing, in real time, that the arrangement they had organized themselves around was gone. Priya cornered her by the supply room at 4:40. Is it true you gave them a notebook? Who told you that? Everyone's saying it. Emily pulled a box of dressings off the shelf. I gave them documentation of things I personally observed over 3 days. That's all it was. That's a notebook. It's a notebook, Emily agreed. Priya was quiet for a second. Then, in a rush, like she'd been holding it, in February she pulled me off a chest pain workup, told me in front of the patient that I wasn't ready. I sat in my car for 20 minutes after that shift. She swallowed. I didn't say anything. I didn't file anything. I just didn't. I know, Emily said. You're not going to tell me I should have? No. Emily handed her the dressing box. I didn't either. Priya took the box. She held on to it for a second longer than she needed to. Okay, she said, and went back to work. Nadia found Emily in the break room at 6. She sat down and put a piece of paper on the table and slid it across without preamble, which was becoming her signature move. Emily read it. It was an internal posting. Trauma Response Educator, Emergency Services. Newly created position. Responsibilities include protocol development, staff simulation training, and clinical oversight of trauma team readiness. It went up an hour ago, Nadia said. Takahashi wrote the job description. That's a coincidence. It is absolutely not a coincidence, and you know it isn't. Emily read it again. There was a line near the bottom. Preferred qualifications include documented experience in high acuity or austere trauma environments. Subtle, she said. He's a subtle guy. Nadia leaned back. Are you going to apply? Emily set the paper down. I don't know. Why not? It was a fair question, and Emily didn't have a fully assembled answer for it. She had one that was partly assembled, which was that she had come to Cedar Falls specifically to be a person who did not carry responsibility for other people's readiness, and that a position which required her to teach 18 nurses how to function under pressure was, in a very direct sense, the opposite of that. "I came here to be small," she said. "On purpose." Nadia considered that. "How's it working out?" Emily laughed. An actual laugh, short and surprised. The first one she'd produced inside this building in 4 months. "Not well." "No," Nadia agreed. "It's really not." Webb was awake at 7. He was back in the ICU, which he was not happy about, and he had a new set of drains and a new incision, and the profoundly irritated expression of a man who had walked a corridor on his own 2 feet 48 hours earlier and was now being told he could not sit up past 30 degrees. Varga was in the chair by the window instead of standing at it, which Emily read as a sign that even Ellis Varga had a limit. "They tell me you called it," Webb said. His voice was worse than last time. "It would be for a while." "Torres called the code. Vance did the procedure." "Vance told me you got the ultrasound window and named the tamponade before the surgeon was in the building." He shifted, winced, and did not stop looking at her. "Second time in 6 days." "You're going to have to stop doing this," Emily said. "It's becoming a habit." The corner of his mouth pulled. "I'll take it under advisement," Vargas said from the chair. "Board meeting went the way you'd want." "I heard some of it." Webb's eyes came back to Emily. "Winslow told me they offered you a position." "They posted a position. Nobody's offered me anything." "Semantics." "Accuracy." Webb almost smiled and then stopped, because smiling pulled something. "Can I say a thing?" "You're going to anyway." "I am." He settled his head back against the pillow. "There's a version of this where you take the job and it's a reward. A thing they give you because they feel bad and because a bunch of guys in dress uniform made a scene in their hallway." He paused. "That's not what it is. What it is that this place doesn't know how to run a trauma bay under pressure, and you do. And if you leave, the next guy who comes in bleeding gets whatever they've got instead of whatever you've got." Emily was quiet. "That's not a compliment," Webb said. "That's a math problem. You're really committed to this framing." "It's a good framing." She looked at him for a long moment. "I'll think about it." "That's all I'm asking." She was almost at the door when Vargas stood up and said, "Carter, one more thing." She turned. "Winslow's flying out Sunday. Before she goes, she's putting through a commendation package. Civilian recognition. It goes up the chain and gets read by people who don't know your name yet." He was watching her carefully. "You should know it means the incident from 3 years ago gets attached to it. The full report." Emily felt something go cold at the base of her spine. "The fire report is public record." "The fire report is." Varga's voice was even. "The service record isn't." The room was very quiet. Webb's monitor beeped its steady, indifferent rhythm. "You're telling me they're unsealing it," Emily said. "I'm telling you that a commendation package requires supporting documentation and that some of your supporting documentation is currently sealed, and that the process to change that has been initiated." He paused. "I thought you should hear it from me rather than from a form letter." Emily stood in the doorway of the ICU room and thought about 14 months in a forward surgical unit and a set of certifications that did not appear on any civilian resume, and about how carefully she had built a life in a small Iowa town on the specific foundation of nobody knowing any of it. "Okay," she said. She went home. She slept badly. The letter came Thursday. It was not from the Navy. It arrived at her house in a plain envelope with the return address of the Iowa Board of Nursing, and Emily stood in her kitchen at 7:15 in the morning with her jacket still on and read it twice before the shape of it fully landed. Notice of formal complaint and initiation of investigation. The board has received a formal complaint alleging that the licensee performed clinical interventions exceeding the authorized scope of practice for a registered nurse on multiple documented occasions, including but not limited to independent diagnostic assessment, direction of physician clinical decision-making, and performance of diagnostic imaging without documented credentialing. She read the specific incidents: the lateral bleed identification on the 14th, the pediatric intervention in Bay 5, the flail chest assessment during the multi-vehicle trauma, the cardiac ultrasound in room 412, the one that had found the tamponade, the one that had kept a man alive. Every single instance was an event where she had been right. She turned to the last page for the complainant. Complainant, Dennis R. Holloway, former director, Emergency and Acute Services, Riverside Memorial Medical Center. Filed 20-14. Filed at 8:14 the same evening he had been walked out of the building. At the bottom, in smaller type, was the line that made Emily set the letter down on the counter and put both hands flat on either side of it. The licensee may submit documentation of any specialized training, credentialing, or authorized practice history relevant to the allegations. Documentation submitted must be verifiable and releasable to the board. Sealed or classified records may not be entered into evidence. The only proof that she had been trained to do every single thing on that list was in a file that no one in the state of Iowa was cleared to read. Emily read that line 4 times, then folded the letter along its original creases and put it back in the envelope, because her hands wanted something to do and folding was available. Then she went to work. It was objectively not the correct decision. The correct decision was to call an attorney at 7:15 in the morning and start building a defense. What she did instead was drive to Riverside Memorial, clock in at 7:52, and work a full shift with a nursing board investigation notice sitting in the glove compartment of her car, because she had spent 3 years constructing a life around the principle that if she kept moving forward at a steady pace, the things behind her would eventually lose interest. She got through until 11:40 before Takahashi found her restocking a med cart with the mechanical precision of someone whose hands were operating independently of her brain. "You've counted those flushes twice," he said. "I'm being thorough." "You're being somewhere else." He leaned against the wall, arms folded. "What happened?" Emily set the box down. There was a version of this where she said nothing, and he let it go, and she was tired enough to want that version. But she had spent 4 months at this hospital saying nothing and had recently learned what that strategy cost. Holloway filed a complaint with the state board, she said. Scope of practice: 4 incidents. Takahashi's expression did not change, which she was learning meant it had changed considerably. Which 4? The lateral lead, the pediatric DSAT, the flail chest, the cardiac window in 412. Every one of those was under my direction or Brandt's or Vance's. Not in the way he's framing it. How is he framing it? Independent diagnostic assessment, direction of physician decision-making. Emily kept her voice level. He's saying I told doctors what to do. Takahashi was quiet for a moment. When he spoke, there was something in it she hadn't heard from him before. A flat, cold anger that had no performance in it at all. He filed it the night he was walked out, 8:14. That's not a complaint, Takahashi said. That's a receipt. He pushed off the wall. Come with me. I have 4 patients. Priya has your 4 patients. Come with me. They went to the second floor, to the conference room that Naval Coordination had still not fully vacated, where Lieutenant Commander Darrow Winslow was in the process of packing a folder into a case and did not look pleased to be interrupted until Takahashi put the envelope on the table in front of her. She read it standing up. It took her 90 seconds. He named the ultrasound, she said. He named all of it. No. He named the ultrasound specifically. Winslow tapped the page. That's the one where a patient would be dead if you hadn't. He put that in a complaint alleging you exceeded your scope. She set the letter down. That's not a man protecting patients. That's a man who went home, poured himself a drink, and looked for the biggest thing he could throw. Does that help me? Eventually, not immediately. Winslow sat down. Tell me what you know about how the board handles this. They investigate. There's a hearing. If they find against me, my license is suspended or revoked. And your defense is documentation of specialized training, which is sealed. Partially sealed, Winslow said. That's not the same thing, and the difference is going to matter more than anything else in this room. Emily looked at her. Explain. Your operational record is classified. Where you were, who you supported, what the mission profiles were. None of that is coming out for a very long time, and possibly never. Winslow pulled a legal pad toward her. Your training record is a separate file. Course completions, certification numbers, instructor sign-offs, competency evaluations. That's administrative. It's protected, not classified. It can be released on request through a formal process. How long is the process? Normally, 6 to 10 weeks. When's my hearing? Winslow checked the notice. 23 days. Nobody said anything for a moment. Then it doesn't work, Emily said. It works if somebody expedites it. Winslow was already writing. I have exactly one favor of that size available to me, and I've been holding it for 11 years for something worth spending it on. She looked up. This is fine. I'd like to spend it on this. Emily opened her mouth and found nothing in it. Don't, Winslow said, not unkindly. You'll make it weird. The next 19 days were the worst. 19 days Emily had spent since the fire. Not because of the hearing. The hearing was a fixed point on a calendar, and fixed points were survivable. It was everything around it. Holloway did not go quietly into the process. On the fourth day, an article appeared in a regional healthcare trade publication under the headline Iowa Hospital Under Scrutiny After Internal Purge, in which an unnamed former administrator described a facility that had capitulated to external military pressure and elevated an unlicensed practitioner over credentialed staff. It did not name Emily. It described her in enough detail that everyone in the building knew. On the sixth day, 2 more former Riverside employees were quoted. One of them had left 8 years earlier and had never worked in the emergency department. On the 9th day, Emily's landlord received a phone call from someone asking whether she was current on her rent. She did not handle any of it gracefully. She wants the record to show that. She snapped at Priya over a mislabeled specimen, a small thing, a nothing thing, and she heard her own voice come out with an edge in it and saw Priya's face close, and she had to stand in the supply room afterward with her palms against a shelf for 90 seconds before she could go back out and apologize. She did apologize. That mattered. But she had needed the 90 seconds, and there had been a moment inside them where she had understood, with total clarity, exactly how a person becomes. Linda Brooks. Not through cruelty, but through 100 small, unaddressed moments of being frightened and taking it out on whoever was closest. She started running again. 5 miles in the dark before shift, on the bike path along the river, because it was the only reliable way she had ever found to make her body tired enough that her mind stopped rehearsing arguments. On the 12th day, an envelope arrived from an address in Cedar Falls she didn't recognize. Inside was a 4-page written statement, notarized, signed by Linda Brooks. It documented, in dry chronological prose, every reassignment she had made of Emily Carter over 4 months. The fact that those reassignments had been based on personal judgment rather than clinical criteria. The fact that on the 14th she had attempted to remove Emily from an active trauma bay against physician direction. And in the final page, a specific and unambiguous statement that in each of the 4 incidents named in the complaint, Emily Carter had operated under the direct verbal authorization of a supervising physician, and that Dennis Holloway had never been present for any of them. There was a note clipped to the front. 6 words. This costs me. Use it anyway. Emily sat down on her kitchen floor with her back against the cabinets and read it 3 times. She did not forgive Linda Brooks. That had not changed and would not change. Forgiveness was not a thing you owed someone because they did one correct thing after 200 wrong ones. But she sat on her kitchen floor for a long time, holding 4 notarized pages that a woman under her own board referral had chosen to sign. And she understood that people were not one thing, and that this was inconvenient and true and would keep being true for the rest of her life. She sent it to Winslow at 11 at night. Winslow replied in 4 minutes. Understood. This is significant. The training file cleared on day 18. It arrived as a certified packet, 41 pages, containing course completions and certification numbers, and competency evaluations with dates and instructor signatures, and a 1-page cover letter on Navy letterhead, stating that the enclosed constituted a complete and verifiable record of the specialized medical training completed by the named individual and was released without restriction for the purpose of licensing adjudication. It did not say where she had been. It did not say what she had done. It said, in the flat, unbeautiful language of administrative record-keeping, exactly what she had been trained to do, by whom, and to what standard. Emily read it in her car in the hospital parking lot with the engine off. Tactical combat casualty care, advanced, emergency war surgery, surgical assist qualification, prolonged field care, point of care ultrasound, extended focused assessment, instructor level certification, dated 4 years before she had ever set foot in Iowa. Instructor level, she had taught it. She put her forehead against the steering wheel and stayed there for a while. The hearing was in Des Moines, in a state office building with fluorescent lighting and chairs that had been chosen by someone who did not expect anyone to sit in them for 4 hours. Emily wore the gray blouse, short sleeves this time. She had thought about it for a long while in front of the mirror at 5:40 in the morning and had made the decision consciously, which was different from the way she usually made decisions about her arms. She was not going to walk into a room to defend her competence while hiding the evidence of it. The board was 5 people at a long table. The presiding officer was a woman named Delphine Arsenault, a nurse of 34 years who had the specific, unimpressed calm of someone who had heard every possible version of every possible excuse. Dennis Holloway sat at the complainant's table in a good suit with an attorney beside him. He had gotten a haircut. He looked, Emily thought, like a man who had spent 3 weeks constructing a version of events he now fully believed. The hearing opened with the complaint read into the record. Then Holloway's attorney made his case, and it was, Emily made herself acknowledge this, not a stupid case. It was built on a real thing. Scope of practice mattered. Nurses who freelanced diagnostically got patients killed. The attorney laid out 4 incidents in which a staff nurse had made diagnostic determinations and directed physician action, and he did it soberly. And for 11 minutes, Emily sat in a state office building and listened to her own best moments described as a public danger. Then Arsenault said, "The licensee may respond." Emily's attorney, a woman named Inez Bardals, whom the hospital had retained and who had turned out to be significantly better than the hospital probably intended, stood up and said, "The licensee will respond primarily through witnesses, but first the board should have this." She entered the 41-page packet. The room went quiet in a particular way while 5 board members read the cover letter. Arsenault looked up first. "This is verified?" "Certified and released without restriction. Verification contact is on page 1. Instructor-level qualification in point-of-care ultrasound," Arsenault said slowly, "dated 4 years before the incident in which the licensee is alleged to have performed diagnostic imaging without credentialing." "Yes, ma'am." Holloway's attorney was already half standing. "The relevant credentialing is facility-specific." "It is," Arsenault agreed. "We'll get to that. Sit down." The witnesses took 2 hours. Dr. Aaliyah Brandt testified that on the night in question, she had been the responding physician, had been outside her specialty, and had made a conscious decision to authorize the licensee's ultrasound assessment because the licensee had correctly identified jugular venous distension and a pressure trend that Brandt herself had not yet integrated. "I want to be extremely clear," Brandt said. "I did not have that assessment made at me. I asked for it. On the record, in the room, with 6 people present." Dr. Vance testified that he had arrived to a patient in pulseless electrical activity with a confirmed pericardial effusion already identified and localized, that this had saved him somewhere between 4 and 8 minutes, and that 4 to 8 minutes was the entire margin in a tamponade. I was asked whether the identification had been within scope. He said, "It was within competence, which is the only question I care about at 2 in the morning." Torres testified about the crash cart drawer, which was not strictly relevant, and Arsenault let him finish anyway, because it was the most honest 30 seconds of the day. Dr. Ren Takahashi testified for 19 minutes without notes. He described the trauma activation on the 14th. He described identifying a lateral bleeder as a physician decision that he had made on information provided by a nurse, which he characterized as the entire functional basis of emergency medicine. He was asked by Holloway's attorney whether he had ever felt his clinical authority undermined. "No," Takahashi said. "Never? In 17 years I have had my clinical authority undermined many times. Never by her." He paused. "Would you like the list of who?" The attorney did not want the list. Nadia Osei testified about the pediatric bay. Priya Ramanathan testified about the assignment patterns, voice shaking for the first 90 seconds and then not. Ruth Oyalaran testified as board chair regarding the internal findings, and when asked directly whether the hospital considered Emily Carter's conduct to have exceeded scope, said, "The hospital considers Ms. Carter to have been the only person on that floor operating at the top of hers." And then Linda Brooks's notarized statement was entered. Holloway's attorney objected on the grounds that the declarant was herself under board referral and had an interest in the outcome. "She does," Bardales agreed, "an interest in the opposite outcome. The statement establishes that she reassigned the licensee for non-clinical reasons and attempted to remove her from an active trauma bay. That's aggravating to her own referral, not mitigating. She had nothing to gain by signing it. Arsenault read the fourth page twice. "It's entered," she said. By 2 in the afternoon, the room had changed temperature. Emily could feel it, the way a room feels when the thing everyone came in assuming has quietly inverted. Then Arsenault said, "Mr. Holloway, I have questions for you." Holloway stood and buttoned his jacket. "You filed this complaint at 8:14 p.m. on the 20th. That's correct? What time were you terminated?" A pause. "I was informed of the decision that morning." "What time did you physically leave the building?" Longer pause. "Approximately 6. So you were escorted out at 6 and you filed a scope of practice complaint against a staff nurse at 8:14. Arsenault set her pen down. "In the 24 months you served as director of that department, how many scope of practice complaints did you file with this board?" Holloway said nothing. "The answer is none," Arsenault said. "Not one. Including in the 24 months in which you received 3 formal complaints alleging a supervisor was systematically removing qualified nurses from critical assignments, which you closed without investigation." She looked at him. "Mr. Holloway, you had 4 months of opportunity to raise a patient safety concern about this licensee while you had the actual authority to act on it. You raised it 2 hours after you lost that authority. I raised it when I became aware of the pattern. You were aware of the pattern. You approved the write-ups. Those were personnel matters. They were the same incidents." Arsenault's voice did not rise. It just got very precise. "You disciplined her for these acts as workplace insubordination when it protected your unit's chain of command and reported them as patient endangerment the moment it damaged the woman who cost you your job. Those two positions cannot both be sincere." Holloway's attorney put a hand on his arm. Holloway shook it off. "She has no business in a trauma bay," he said. His voice had come loose from the careful register he'd held all morning. "Look at her. She walked in here. Look at her arms. And I'm supposed to believe—" The room stopped. It was, Emily thought afterward, the single most useful thing he could possibly have said, and he had said it entirely on his own, and nobody had made him. Arsenault let the silence run for 4 full seconds. "Mr. Holloway," she said, "would you like to finish that sentence?" He did not finish that sentence. "For the benefit of the record," Arsenault said, "the marks the complainant is referring to are documented in a public fire incident report from 2021, in which the licensee entered a burning residential structure 5 times and removed 5 occupants, sustaining third-degree burns to both forearms." She turned a page. "The report is attached as Exhibit 11. It was submitted by the licensee's counsel. She did not want it entered. I asked for it." Emily looked at the table in front of her. "This board will recess," Arsenault said. "Bob." The recess lasted 40 minutes. Emily spent it in a corridor with vending machines, standing, because sitting felt like something she'd have to undo. Bardales came out at 3:12 and said, "They're back." The finding took less than 3 minutes to deliver. The complaint was dismissed in its entirety. The board found that in each of the 4 cited incidents, the licensee had operated under documented physician authorization and within demonstrated competency, that her specialized training exceeded the standard alleged to have been breached, and that no finding of any kind would attach to her license. Then Arsenault said, "There is a second matter." Emily looked up. "This board takes bad faith complaints extremely seriously, because every hour we spend on one is an hour we do not spend on an actual dangerous practitioner." Arsenault looked directly at Holloway. "This complaint was filed in retaliation by a terminated administrator against the individual whose disclosures contributed to his termination. The board will be forwarding the full record of this proceeding to the state's healthcare licensing authority with a recommendation regarding Mr. Holloway's administrative credential, and to the Attorney General's office for review under the Healthcare Whistleblower Retaliation Statute." Holloway's attorney began to speak. "We're adjourned," Arsenault said. He lost the credential in November. The retaliation review took longer and ended in a consent judgment that he did not have the resources to fight. The trade publication that had run the article printed a retraction that nobody read, and by the following spring Dennis Holloway was, according to a thing Priya heard from someone who heard it from someone, selling insurance in a suburb of a city 3 states away, which was a perfectly respectable job that he was welcome to do for the rest of his life. Linda Brooks's referral concluded with a permanent bar from supervisory practice and a 2-year restriction on her license. She served it. Emily heard much later that she was working nights at a long-term care facility in a town of 4,000 people, doing direct patient care, which was the only thing she had ever actually been good at. Emily thought about writing to her once. She decided not to. Some things did not need a coda, and she had stopped believing that every story required everyone in it to be reconciled. The ceremony was on a Tuesday in October, in the Riverside Memorial Atrium, because the auditorium had been booked for a vendor conference that nobody had the authority to move. It was therefore not a grand setting. There was a folding stage. The acoustics were bad. Somewhere on the second floor, a floor buffer was running and could not be turned off. And for the first 6 minutes of the ceremony, it provided a low mechanical hum underneath everything. Emily thought this was perfect. If it had been beautiful, she would not have been able to stand it. They came anyway. The entire day shift came, and most of the night shift on their own time, and the fourth floor sent everyone who could be spared, and Torres brought his wife. Ruth Oyalaran spoke for 4 minutes and did not soften anything. She said the hospital had failed, named how, and said what had been built since. An independent complaint pathway that routed outside the reporting unit, a hard staffing floor with no discretionary override below director level, and a mandatory review of every closed complaint from the previous 5 years. Then Lieutenant Commander Dara Winslow read the commendation. It was short. It cited extraordinary civilian action in the preservation of life, twice, in the emergency care of a service member. It cited the fire. It cited, in one careful sentence, prior service of a nature the citation does not describe. And then Marcus Webb walked up onto the folding stage under his own power, in dress uniform, 6 months out from a chest that had been opened twice, moving like a man who had negotiated hard with his physical therapist for the right to do this without a rail. He did not make a speech. He had, apparently, learned something about himself. I got one thing to say, and then I'm getting off this stage before I fall off it. A laugh went through the atrium. Webb waited it out. Every hospital in this country has somebody in it who's better than the job they've been given. Usually they're quiet about it. Usually there's a reason they're quiet about it. He looked out at the room, at the day shift and the night shift and the fourth floor. You've got one of those people. You had one for 4 months and you spent them making her carry boxes. Nobody laughed at that. Find yours, Webb said, before something bleeds. He turned to Emily and saluted, and this time he was the only one on the stage, and it was somehow worse, and she had to look at the floor for a second before she could look back up. She wore short sleeves. She had thought about it again, and had made the decision again, and would keep making it, because it turned out that this was not a thing you decided once. Her arms were what they were. In a well-lit atrium under bad acoustics, in front of 200 people, they were exactly what they were. She did not hide them. She was, by that point, out of the practice of it. She took the job. Not immediately, and not on the terms it was offered. She sat in Oyalaran's office for an hour in November and negotiated like someone who had learned the hard way what unwritten arrangements were worth. She wanted the trauma education position to sit outside the ER's reporting line, with direct escalation to the board. She wanted authority to pull any nurse from any assignment for simulation, regardless of that nurse's charge preference. She wanted a written clause that no member of the training cohort could be disciplined for an intervention made under physician authorization. That's a lot, Oyalaran said. It's the list of things that would have prevented all of this. Oyalaran signed it. The program was not smooth. Emily wants to be clear about that too. The first simulation she ran was a disaster. She pushed the scenario too hard, too fast, out of a set of instincts calibrated for people who had volunteered for something much worse than a nursing job. And 2 of her nurses left the room genuinely shaken, and one of them submitted a complaint through the new independent pathway. The complaint was investigated properly. It was upheld. Emily had to sit across a table from a reviewer and hear that her instruction had been outside acceptable bounds, and she had to accept it. And she did, and she rebuilt the entire curriculum over 6 weeks. She was better at it after. That was the point of the pathway. It worked on her too, which was the only way it was ever going to be worth anything. By the following June, the ER's mean time to critical intervention had dropped by a number Oyalaran cited so often that people started making fun of her for it. Priya Ramanathan ran her first trauma activation as primary in July and did not sit in her car afterward. Nadia Osei matched into emergency medicine and stayed mom. There was a Thursday in August, near the end of a shift, when a new nurse, 23, 6 days on the floor, so nervous she was writing things on her hand, stopped Emily in the corridor and then clearly regretted stopping her. Sorry, I just... She looked at Emily's arms and then very deliberately at Emily's face, and the deliberateness of it was so visible and so kindly meant that it was almost funny. Can I ask you something stupid? You can ask me something. How do you know? The girl's hands moved. When to say something. When you're the newest person in the room and you think you see something and everybody else is more qualified than you and they've all been here longer and you're probably wrong. How do you know when to open your mouth? Emily stood in the corridor and thought about the answer she wished someone had given her 4 years ago. You don't, she said. That's the actual answer. You never know. You say it anyway, and sometimes you're wrong and you look stupid, and the cost of looking stupid is about 90 seconds of feeling terrible. She paused. The cost of the other thing is a person. That's not very comforting. No, Emily agreed. But here's the part that is. Nobody in that room can take your competence away from you. They can take your assignment. They can take your shift, your title, your schedule, your dignity if you let them hold it for you. They cannot reach inside you and remove what you know how to do. She shrugged. I spent 4 months waiting for people here to recognize what I could do, like it was theirs to hand over. It never was. It was mine the whole time. All they controlled was whether the room got the benefit of it. The girl looked at her. Speak up, Emily said. You're the one who saw it. She went home that night the long way because she still did that, past the river and the bike path and the flooded corner of the parking lot that would never be fixed. She made an actual dinner. She sat at her kitchen table in the quiet of a small house in a small town in Iowa. A woman with ruined forearms and a steady pair of hands, and she was not hiding from anything at all. That was the whole of it, in the end. Not the salute, though the salute was something. Not the commendation, not the hearing, not the man in the good suit losing everything he'd built by protecting the wrong thing. It was that she stopped waiting for permission. They will tell you to be smaller. They will point at whatever mark life has left on you and call it evidence against you. And if you let them, you will spend years apologizing for the exact thing that proves what you are. Don't. Carry it where people can see it. Do the work in front of you at the top of everything you know. And let the room decide what it wants to do about that. Because the ones who are afraid of you will always be louder than the ones who need you, right up until the moment somebody starts bleeding. And then it will only ever matter that you were in the room and that you were ready.